Hello, young dentists, and this presentation is for those who graduated recently, not so long. You haven't done a lot of wisdom tooth extraction. You want to know a little bit more the tip and tricks about wisdom tooth extraction, how to identify difficult case and simple case. In this particular video, I will be talking to you about evaluating the panoramic x-ray and all the potential x-ray that you need. You look at the x-ray on tooth number 1 and 32. I'll be taking out tooth number 1 and 32, and this is the x-ray of the panoramic look. A lot of us sometimes we rely on x-ray only, the two-dimensional x-ray, which could be difficult to completely predict how difficult it could be. Ideally, nowadays with the technology of 3D imaging, like CT scan, if you're able to obtain the 3D X-ray, that would really be helpful for you to see the potential complication, whether how many root the tooth might be. That's where you be more prepared to handle it. I'll be talking to you the basic concept of diagnose and getting ready to treat the case when you need to remove wisdom tooth. So if the patient come in with a chip complaint that they have been having a lot of pain on the wisdom tooth area, and you diagnose if it is the perioconitis, like acute pain, and you're ready to get the tooth out, some of the things that you want to look for would be how big is the patient mouth? Are you able to access the tooth surgically using handpiece, using blade, using periosteal elevator, using elevator? All of those visibility and accessibility is really important factor whether determine you're going to get the job done quick or hard. The other factor I would be looking at is would be age. How old is the patient? If the patient is less than 21, 22 years old, probably the tooth won't be that difficult to remove. But if the patient is older than 27, 26 years old, and it depends on ethnicity, some ethnicity is just like Asian or African American could be very hard bones, solid bone, mature bone can be really difficult to remove. Evaluate the root, whether the root is fully developed or is it halfway developed. If it's fully developed, you might have a hard time to remove. Now, evaluating the root in using panoramic, sometimes it cannot be completely easy because only two dimension. So ideally, CT scan will help you to determine whether the tooth have 2 or 3 root. Okay, in this particular one, there is 3 root for tooth number 1. When I took this out, 3 root, guys. It wasn't a simple elevation process. It took me several different kind of elevator to do this. That is difficult. That's why it is sometimes when you evaluate the panel only, you may miss out the aspect of the palatal root, the curve of the root, and so be careful. Sometimes it can look simple, but it could be really hard. In this case, I basically just try to elevate the tooth out using a lot of different elevator and try to really luxate and elevate this and until tooth really loose, and I use the 150 to remove it. And on tooth number 32, I would have to cut the tooth into section the tooth into a meso and distal root and take them out. I fractured a couple of times with this because it was his patient mouth wasn't that big, so I have a hard time of seeing clear everything. But at least this is a complete erupted tooth, so it wasn't that bad. But anyway, it's actually funny. It took longer to get the tooth number 1 out than number 32 today. That's because of the visibility and the 3 root that you see, the curve root there. Again, just to summarize for young dentists, best thing to do to take our wisdom tooth is uh, evaluate the patient clinically, see if you can go in and using different surgical tool. If you cannot see much, that means it could be very complicated. It could be very hard. So prepare for that. The other thing would do is evaluate carefully the root of the tube, and also evaluate the patient ethnicity, and also the evaluate the age of the patient, whether the patient is fully developed maturely with the root, the bone, based on the age. Those factors really help you to make the decision whether you do it yourself or refer out. Again, it's 5 minutes presentation. Thank you for watching. I hope you learned something. Have a good day. Bye bye, guys.